And the reason this is going to be great, I'll have this recording up by Wednesday afternoon, Thursday morning at the very latest. So, number one, if you've missed it or know somebody you have to leave early or know somebody you'd like to listen to this, it'll be up. But also, there's a lot of information that comes across with this. So, I would say to you that you can listen to it again, you can listen to it again and make some decisions. But again, good morning. Again, I am Ann Church. I'm with Villages of Santa Fe. And with us presenting today is Brad Coe. And Brad, again, has been with us for 8 years since 2016 from a very start. And we're so glad to be able to present this information for all of us because our healthcare is really important and knowledge is really the power. And things are really changing very quickly right now. As Brad and I were just discussing, their Medicare Advantage programs are being pulled. Their Plan D, which is the supplement plan, if you have a Medicare supplement, they're changing and moving all over the place. So I want to welcome everybody today. We'll go forward. If you have a question, just put it in the chat or raise your hand. We will be dealing with today is original Medicare versus Medicare Advantage. So focusing more on Medicare Advantage and what's going on in that market. So good morning, Brad. I'm going to turn it over to you. If you'll introduce yourself, I'm going to mute me.
Thank you, Ann. I want to thank everybody for joining us today. This is always a great opportunity for me and an honor to have these couple of information seminars. And as if you've been on this before, there's a couple of housekeeping pieces I need to make. One of which is that this is an educational seminar. So meaning that it's just bringing out general information about things. There's no specific carrier information. So in your chat, if you do have a question, please say something to the effect of my Medicare Advantage plan or something along those lines. Second is that I'm not an agent or a employee of the U.S. government. I'm an independent agent. So everything that I'm going to go ahead and say today, you will not hear back from me unless you reach out to me. And that's all. We're going to be looking at the two ways to approach or administer Medicare. And I need to be careful on this because, Medicare is like this word like Xerox. It can mean a whole lot of things. It can mean, I've heard people tell me, go Xerox this, meaning go copy this. Or, they just put copy machines in as Xerox. So Medicare is one of those words. So I'm going to be very careful on how I choose my words. So Medicare, if I'm going to go ahead and talk about it, it's the program. If I'm talking specifically, then I'm going to try to use the specific terms. So please bear with me on this. This should help with any communication that we end up having. People always say to me that Medicare is very confusing. I've had people with PhDs give me a call and they're just frustrated because they feel like the more they research it, the more that they should understand it. And it is the proverbial rabbit hole where once you start getting down there, it gets really kind of, not convoluted, but it's a mess because what we'll go ahead and be touching on is the private insurance companies becoming involved. So once the private insurance companies become involved, now suddenly we start bringing in things like marketing and advertising and plan placement. So now, we're talking about one type of product, but they have designed 6 different designs for it to try to capitalize on a certain population. So we'll get into that. Medicare itself is made up, the program of Medicare is made up by 4 components: Part A, Part B, Part C, and Part D. That's probably the simplest thing we're going to go over today that will keep this in order. But with Part A and Part B, that is considered original Medicare. So those are the original plans that were in place. The other two components did not come out until the mid 2000s. So when I'm going to be very careful again to say, like, enrolling in Medicare, what I'm talking about is enrolling in original Medicare. The Part A is for inpatient admission. And so anything where you're admitted into a facility, those benefits are covered under Part A. Part B is medical. And essentially, it's anything if you're not admitted into the hospital and it's not a prescription, it falls under Part B. Part D, I'm going to hop over C right now. Part D has to do with the prescription drug plan. That's the prescription drug plan that's how the prescriptions are handled outside of the hospital. If you're admitted in the hospital, the prescriptions are included. Once you're outside of the hospital, then it's not included. Thus, we need another design, a Part D. The reason why I hopped over C is because A, B, and D are easy to explain. Admitted in hospital, medical, and prescription. So that's easy to follow. The Part C is the Medicare Advantage program. And that is, and the operative word is it's a program. It's not suddenly a list of benefits that you end up having if you're admitted in the hospital. Excuse me. It ends up being where a private insurance company can develop their own Medicare plan. It's got to be as good or better than original Medicare. So you don't lose any benefits. But as we'll get into this, we'll see that there are some differences in how they approach administering Medicare benefits. Excuse me. All right. So I always love this slide because it really comes down to why are we talking about original Medicare and Medicare Advantage plans? It's because when somebody comes into Medicare, they have two options on how they want to administer Medicare. Option one is what I have coined as the four-legged stool. We have four separate components that comprise a comprehensive health plan. So we piecemeal it together. How do we piecemeal it together? Well, original Medicare is your insurance company. So your red, white, and blue Medicare card is your insurance card. Centers of Medicare and Medicaid is your insurance company, and your network for hospitals and medical is anybody who accepts original Medicare. So you got to think that that's your primary insurance. That is your primary health insurance. Now, what we discussed earlier was that we don't have an outpatient prescription. So we end up adding the Part D plan onto this. Those can be standalone. So, ABC Insurance Company has a prescription drug plan, and that's what we're adding into this. So at this point, we have three of the four legs, and it is a comprehensive plan now, meaning that it covers hospital, medical, and prescription drugs. So it's a comprehensive health plan. But what we'll get into a little bit later on, and I'll kind of gloss over it right now because we don't want to head down this road, is that there is some exposure with this design. And that becomes why we end up adding the fourth leg, which is a Medicare supplement plan, or it's also known as a Medigap plan. We're not going to be getting into those, but just know that this is one of the options you have on how to administer your Medicare, original Medicare, add a prescription drug plan, and possibly we add a Medicare supplement plan. The second option is our Part C, the Medicare Advantage plan. Now, we'll talk about this later, that A and B, your original Medicare, you must still keep active, but you will not access care directly from original Medicare or from the Centers of Medicare and Medicaid. This is where the insurance company has developed their own plan, and you get your insurance from the insurance carrier. So and a lot of times these plans will package in a prescription drug plan. So it's a package deal, and it looks, and we'll get into this in a little bit. So these are our two options. So that's why we have this seminar to talk about the two options. And I will say this up front. Pretty much everybody who's coming into Medicare says, which is the best plan? We don't use the word best because that's subjective. What we want to know is what's the most suitable plan for you. And when we start to break down the differences between original Medicare and adding these other components, or a Medicare Advantage plan, that typically ends up getting to the point where the rubber meets the road and people then can say, well, that's important to me, and that's the direction we go into. Okay, so if I'm trying to get this out of my way. Okay. When to sign up or make changes to your Medicare. So did I just lose it?
Yeah, I lost your screen
And
share. I lost your screen share.
okay. Is it back up?
Yeah, there he is. It's on the
There
second
it is.
slide. Got it.
Okay. So when we come into Medicare, most of the time that means by
Brad, we are on slide 2. I think we need to go down a little bit.
I've got, all right. Stop sharing, share. All right, are we?
I'm on, slide 2 is what I'm on right now. I'm on the Medicare Part A, B, C, and D.
Well, where are you? One. What is this showing, Ann?
No, I think you're right, the right place now. Yeah, you are. Yeah.
Okay. So when people are coming into Medicare, everything that we do because of the government plans ends up being that there has to be an eligible period for you to go ahead and come in to enroll in certain things. So when it comes to original Medicare, we have 3 different enrollment periods. We have an initial enrollment period. That's when people first come up to being eligible for Medicare. For most people, that ends up being when you're turning age 65. And why do I say most people? Because a person can get on Medicare by being on disability for 24 months. The second piece is the special election period. This is going to go ahead and open up the whole broad spectrum of different situations that you could be going through that will give you an enrollment period. This is everything from natural disasters to leaving your job and losing the coverage at your job. The general enrollment period ends up being when people end up missing their enrollment in the initial enrollment period or special enrollment period. And it's a one time a year at the beginning of the year. But if you don't get signed up, then we start talking about having penalties for not signing up when you were eligible. If you already have Medicare and you want to make changes, you can get coverage in a couple of different places. These enrollment periods are open enrollment period. This is what I typically, and this is me using old jargon, call the annual election period, AEP. That's from October 15th through Pearl Harbor Day, December 7th. And that's when you can end up making changes to your Medicare administration, how you're administering it. If you have a Medicare Advantage plan, so option 2, there's a second enrollment period at the beginning of the year. It's the first quarter of the beginning of the year from January 1st through March 31st, and that is the Medicare Advantage open enrollment period. Why do they have two different ones? Well, during the OEP, the open enrollment period, you can change as many times as you want. It just ends up being that the last one that was made before December 7th, that's the one that's going to be in effect for January 1st. During the Medicare Advantage open enrollment period, you can only make one change during that time, and you have to make it to a like plan. So a Medicare Advantage plan to a Medicare Advantage plan. So why do they do that? Because when we get into this a little bit more, you'll see that you do more managing of a Medicare Advantage plan because of network, and things suddenly can come out like, oh, my doctor stopped taking this, so now I need to change. So my insurance isn't any good. So instead of being stuck in this for 12 months where you can't use it, we go ahead and now we have a chance to change. The other two ends up having to do with being institutionalized. That's a, nursing home, assisted living. And the second one is for special enrollment periods. Again, what we do after during the year. What to do to consider. So let's start in with original Medicare and kind of go through this. Do I need to sign up for Part A? So somebody's coming in and becoming eligible for their initial enrollment period. Something to consider is it's free for most people. Now, I have always not liked the word free in this, but essentially what we'll get into is that you have worked enough and paid into the taxes, the federal taxes, to where you're considered entitled. And when somebody's entitled, then they do not have a premium for Part A. So that's the definition of this. It's free. It isn't free for it if you or your spouse work history isn't sufficient. So again, we're going to get back to our work history. If we don't have enough time involved, then there is a premium for it. And then if you are working still and you have your own, the company has benefits, you want to talk to the benefits administrator to see which is it going to be more enhanced benefits on your group plan versus just signing up for original Medicare? Because there are groups out there that will go ahead and not let you come back after you leave. So just something to think about. Here we are. Part A hospital covers. Here we've got them all here. You're admitted into the hospital. We've got semi-private room, meals, general nursing, prescription drugs, and other hospital services. And now inpatient care in a skilled nursing facility after 3 days of inpatient in the hospital. Now, the hospital's gotten a lot better about if you're going to be transitioned into skilled nursing, which is essentially inpatient rehab, that they know the 3-day rule right now. But it's been a while. I had somebody who discharged from the hospital, put into skilled nursing. They'd only been in the hospital for 2 days, and they find out after 3 weeks that it's not being covered. So, but like I said, most of the hospitals know this now. Also, Part A has some blood for when you're in the inpatient hospice care. So comfort care for your last phase, home health services. This is a misnomer here, is people read this and say, oh, I can have somebody come over and help me with things, and Part A is going to help me. These home health services are medically necessary. So we're talking primarily therapies, physical therapy, occupational therapy, speech therapy. Now, that's this definition of home health services. It is not, I need somebody to come and help me do some things or do some light cleaning. That is not what this is. And then, of course, you can also get coverage on it for having some religious non-medical healthcare institutions. So here we go in. Most people don't pay for Part A premium if you so there's your key there is or your spouse paid FICA taxes, the federal taxes, for at least 10 years. If you read it within Medicare, it says 40 quarters. So 10 years, 40 quarters, 6.5, 1 dozen. You get Part A without paying a premium. You're entitled. You may have to pay a penalty if you don't sign up for Part A when you first are eligible to buy it. So if somebody is coming up to age 65, they don't have any other health coverage or health insurance, but they say, you know what, I'm healthy, I don't want to tax the system, and they get into it, and then they come back later on, they're going to get penalized for it. Then your monthly premium on this penalty could be 10%. And that ends up being for twice as long as you were out. So if you were out for 1 year and you came into Part A, then you would get the penalty for 2 years. Does that make sense? I hope so. And that's what it says there at the bottom. Part B, the medical services. Now we're talking about anything, again, where we're not admitted in the hospital and it's not a prescription. So here's doctor services, outpatient medical services, labs, durable medical equipment, diabetes testing, preventive services, home health services. Again, remember the definition of that. Medically necessary outpatient physical or occupational therapy, outpatient mental health care services, and limited number of outpatient prescription drugs under certain conditions. This primarily ends up dealing with cancer. So I don't like that last line because it still makes it sound like, well, you said that some prescriptions, well, which ones? They're primarily cancer drugs. When people say Part A and B, original Medicare was set up on the old system of insurance on medically necessary. As we came into the 90s and 2000s with our HMO home health net, they were kind of trying to get us to be preventive. And that was where it started to kind of move that we were getting preventive services under original Medicare, but it was getting more defined. And so we needed to come up with some specifics for preventive service. Preventive service is always going to be covered at a zero charge as long as it's still preventive. And here ends up being the list of items on what can be done on a preventive basis. Now, some of these are annual and some of them are biannual. So just because it's on here does not mean that it's every single year, but just to know this is what we mean in preventive. Preventive services on Part B came into play in around 2010, 2011, somewhere in there. And, again, we were making it work before, but this just makes it easier to go ahead and define if this needs to be charged or not. What's not covered under Part A and B? Again, I get back to the medically necessary. So, eye exams. Now, if you have glaucoma, let's say, all right, that's a medically necessary exam. But we're talking about just routine eye exams and then and prescriptions for glasses. Long-term care. So people say, well, I have home health care. No, you don't. You don't have it where it's going to pay for a long-term inpatient stay. Cosmetic surgery, massage therapy, routine physical exams. So you're like, Brad, wait a minute. We just said that you got preventive. Here we go. They had defined two different areas. Physicals were what we typically knew as being our annual preventive. And these primarily where doctors were putting their hands on you and physically inspecting you. The preventive services, which is covered at 100%, those we saw weren't necessarily, let's go ahead and do this test. Everything was pretty much a test or just a visit. There wasn't any physical connection there. So please know that there is a difference between a physical and preventive services. And if a doctor suddenly charges you for a physical as opposed to preventive, well, guess what? It's not covered. So guess who gets to pay for that? You do. So it's imperative to be sure that this is happening. And again, most doctors know this and they code things correctly. Hearing aids, concierge service, covered items or services you get from doctors or other providers opting out of Medicare. So they've got to be, when we were saying, if you have original Medicare as your insurance, you can go to any doctor who accepts Medicare assignment. Well, if they don't accept Medicare, well, then you can't go to them. It won't be covered. And most dental care, again, because it's preventive or the basic or major services with comprehensive medical. But if you had a medical condition, then it would be covered. So broken jaw, for instance. But, a root canal is not covered because that's under routine dental.
So, Brad, we had a question here. What about dermatology? So I guess that really is where you break between what's preventative and what's routine, right?
Correct. So if you go to a dermatologist, and this is let's make it a little bit more broad. If you go to a specialist like a dermatologist, well, you're going to get charged whatever the specialist rate is. But if they find something and they remove it, okay, they're going to go ahead and charge you that. So this is a very good question, Ann, because I want to clarify when I say that something is covered, it doesn't mean that it's paid for at 100%. What it means is, okay, you're going to a specialist, they accept Medicare. Okay, what's my specialist copay, or what's the office visit charge? Okay, you're removing a mole, let's say. All right, that is considered an outpatient procedure. Now, if we start to get into cancer, again, it's covered, but it's covered under other places other than outpatient surgery. So does that answer the question?
Well, I think one of the things people should be aware of, like for example, I'm having surgery next week, and I called Brad and told him what was up, and he was able to inform me as to what I could expect as far as billing or non-billing, or what I'd be paying for or not paying for. So if you want to be very proactive, you can call your agent, or I'm not sure you can call Medicare anymore, but you should be able to call your agent and find out whether it's covered. But when we talk about things that are covered, for example, I guess when you talk about eye exams, I guess when you look at that, I mean, cataract surgery is covered, but your routine eye exam is not, right?
Correct.
There's that defining line that you've got to figure out where you cross over the line where it is covered.
Exactly, and how it's going to be covered. Exactly. So if, and all we're talking about right now is if you had original Medicare as your primary insurance. We're in option one right now defining it. Okay. We're not into option two with the Medicare Advantage plans. When must you have Part A and Part B? To buy a Medicare supplement plan or a Medigap policy that we discussed back on slide 3, and to join a Medicare Advantage plan. So again, we're getting back to what I said is enrolling in original Medicare, or as most people say, I've got to enroll in Medicare, means enrolling in Part A and Part B of Medicare. Once you're in there, that's the foundation. We either use that as our actual health insurance, or we go ahead and use that as a qualification to go ahead and get a Medicare Advantage plan. So you're going to continue to have to pay the premiums of your Part B original Medicare, even though you end up having a Medicare Advantage plan. Why? Because it has to stay active in order for them to have the Medicare Advantage plan. So if you lose Part A and you have a Medicare Advantage plan, the Medicare Advantage plan is going to go away. So Medicare Advantage plans and we end up still having all of the rights and protections of original Medicare, still get the services of Plan A and B, original Medicare, can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing. May choose a plan that includes drug coverage and or extra benefits like vision, dental, or fitness and wellness. This is really where we start to define why the difference between original Medicare and Medicare Advantage is that, if you recall, I said Medicare Advantage plans have to be as good or better. So it's this or better that we're looking at to go ahead and say, well, do we want a plan that includes prescription drug plan? Most people do. They don't want to go ahead and get a couple separates if they can get something that's packaged together. Do I need that eye exam? Do I need an allowance for eyewear? Okay, well then there are Medicare Advantage plans that have that. And there is a yearly out-of-pocket limit. So this is another key point here, is that every one of these Medicare Advantage plans has an amount that if you hit that amount and go above it, you will not be charged for it, that the insurance company will go ahead and pay for it. So we can say that you have kind of a place, a loss, a stop where you're going to stop your loss. So how do these work? You have to be in the service area. Okay, so these plans are definitive to your counties, and so it'll always ask you about putting in a zip code. You or your providers acting on your behalf can request to find out if an item or service will be covered. This again, you can find out, but more times than not, it's the provider's office now who's getting prior authorization for this. So that's kind of what this alludes to. Medicare pays a fixed amount for your coverage every month to companies offering Medicare Advantage plan. So if any of you people are out there wondering, well, how do they get paid? Or why am I getting so many calls for Medicare? It's because of this, that the more people, the more beneficiaries they have in a Medicare Advantage plan, then they get a fixed amount given to them to work with. So some people go over that fixed amount. A lot of people don't go over that fixed amount. So that's where we start to talk about, the amount of money that the insurance companies are making here. Each plan can charge different out-of-pocket costs or have different rules for how you get services. Hospice care is covered by original Medicare. So you're on a Medicare Advantage plan. If you are diagnosed to have hospice, to be on the hospice program, then your Medicare Advantage plan will still stay active, but your hospice benefits will come through original Medicare. So the service you have for hospice will be paid directly by original Medicare. But let's say you get some labs done or something like that. Okay, that could easily be charged under your Medicare Advantage plan. There are 5 types of Medicare Advantage plans. The only 2 that I'm really looking to go ahead, or that we really deal with here in New Mexico, is the health maintenance organizations, HMOs, the defined network, the preferred provider organizations, PPOs. So that's a broader, typically a national network. And then the special needs plans, we're not going to get into them, but they are something that you should know of, because they're specific plans for a specific population. So people who are on Medicaid and Medicare, those are dual eligible special needs plans. People who have congestive heart failure, that is a chronic special needs plan. So know that they're out there, but again, it's not part of this conversation.
Brad,
Typically, what we're looking at right now is HMO and PPOs. Yes.
we had a question. I think we should really go ahead and define that. It says,
I'm sorry, Ann.
I have a question. We have a question. I think we should go ahead and define this. It says, when you sign up for Part A and Part B, are you also given the name of Advantage plan you want to join? People have got to understand these are totally separate. Plan A and Plan B, original Medicare. This is like shopping for your car insurance with Medicare Advantage, as far as I'm concerned. It's up to you to really define what the plan is if you want to go with an Advantage plan, right?
Exactly. And Medicare, Medicare.gov, the website, can assist you with looking at the different Medicare Advantage plans, but you just signing up does not go ahead and they don't give you that list, they don't give you that list. So it ends up being, so yeah, you've got to shop for these plans if the Medicare Advantage is the design that's more suitable for you. Did that answer the question, you think, Ann?
Yeah, I think so. I think again, the emphasis on Medicare, original Medicare is portable, global. If I want to go to a doctor in Portland, Oregon, or a doctor in Houston, Texas, or the Mayo Clinic, I can take my Medicare, original Medicare. Medicare Advantage is not portable like that. So you really have to shop and know what you want, but Medicare Advantage has some really good, I have some good friends that really love their Medicare Advantage. They're perfectly happy with it. But you need, when you're shopping, you need to know the good, the bad, and what works for you.
Correct. I mean, because on your Medicare Advantage plan, this again kind of becomes where another defining part here of the difference between original Medicare and Medicare Advantage plans is the network. So as Ann was saying, you can go to any doctor nationally, get the same coverage that you have. You're not going to be charged an out of network or something. You just have to make sure that the doctor is going to accept original Medicare. When we start talking about Medicare Advantage plans, now the networks become HMOs and PPOs. So I always give the analogy of a funnel. With original Medicare, you're at the widest mouth of the funnel where you're able to see the largest number of providers. But as we saw, there are some things that you lose out on that you're not going to get with original Medicare. When we talk about a Medicare Advantage plan with an HMO network, let's say, these plans typically have a lot of benefits because they're enticing you to stay within the local or regional network. All of these Medicare Advantage plans will cover you in an emergency room and urgent care facility. But if you're on an HMO and you want to go get a second opinion over in Phoenix, that's not going to pay for it. But if you're over in Phoenix and you eat a bad, I don't know, Serrano hot dog, then you can go to the emergency room or urgent care. The PPOs tend to get us in the middle of that funnel where we're not at the very top of all the doctors who accept Medicare, but there is a national network there that you can access and go get a second opinion or treatment with.
Hey, Brad, the other thing is to know that carriers have all these different plans. So in other words, this carrier may have 3 different Advantage plans.
Correct. And they could have different networks. So most of the carriers do have an HMO product, and then they have numerous HMO products and numerous PPO products. And they might not come right out and define it, but we just did that. You're talking about network. That one is a more restricted network. You're probably going to get a lot of benefit out of that because they are trying to entice you to be on their HMO because they can control costs under their HMO better. It's when you go outside of their, defined network or outside of New Mexico that they lose control of their costs. And so they don't really, so the benefits tend to be a little bit less on the PPOs, but you have the luxury of having a national network. Things that you should consider when joining a Medicare Advantage plan, if the plan offers extra benefits, in addition to original Medicare benefits, and if you need to pay extra to get them. So extra benefits are what we're talking about with that a routine vision plan, a dental plan, a hearing benefit on there. And a lot of these plans have a thing called the over-the-counter benefit where they actually give you a quarterly allowance to spend on. It used to be just solely basically non-prescription pharmacy items. So, you know, aspirin, compression socks, band-aids, that kind of stuff. But some of these plans also are broadening this out where you can use this money for different services like food, utilities, and such. But that's that's what we're talking about with extra benefits. Are my doctors in the plan network? This is a kicker here. If you were in a if we're in a plan that ends up having Christus, let's say, in their network, then Presbyterian is going to be considered out of network. If we have a plan where Christus and Presbyterian are in the network, okay, you can go to both of those and there's no difference on there. But we have to go ahead and take a look at the network is so important. That is probably the biggest management piece that you have on the Medicare Advantage plans. You may need a referral to use a specialist. This is true to an extent, but I would like to broaden it to say, just because you go to a specialist may be asking for a provider referral to be sure that you belong, that you have something that is in their school of practice. So you may have, if you were going to go to a cardiologist, the cardiologist may say, okay, you need to send me, your primary care physician needs to send me a referral because I need to know why you're coming here so I don't waste my time. Can you join/leave plans during certain periods? Oh, you can. A join or leave plan during certain periods. That's where we got back to the open enrollment period or AEP, the Medicare Advantage open enrollment period, the special election period. Those kind of things is what we're talking about here. It doesn't work with Medigap policy. So it is against the law to go ahead and have a Medicare Advantage plan and a Medicare supplement or Medigap plan. Okay. So, if somebody's trying to sell you both, then that can't happen. It's illegal to do that. And here you must have Part A and Part B to join, and you must pay your Part B premium as usual, and usually a monthly plan premium. So even though you're on a Medicare Advantage plan and you're not directly covered by Part B anymore, original Medicare, it still has to be active for the insurance company to now get their payment from them. So just remember that. When can I join a Medicare Advantage plan? Here we go. During our initial enrollment period, which begins 3 months before you first qualify for both A and B. So again, it's imperative to say A and B. So let's say somebody ends up like joining Part A because they're entitled, so they don't have a charge, but they're still working and they're staying on their group plan. So essentially, they have devil coverage for hospital, for inpatient hospital, and it's not charging them any less. Well, they're not eligible for a Medicare Advantage plan. It's only when you leave the provider or leave your group and you join Part B that now you are eligible for the for a Medicare Advantage plan. What if I have Part A and sign up for Part B again, you join Medicare Advantage plan with or without the drug coverage as soon as you have both A and B. If I join Medicare Advantage plan, when can I make the changes? Here's all the things that we talked about before. Our OEP, our Medicare Advantage OEP, and our special enrollment periods. Things to consider here. Oh, this is here. Here's a little side by side, and we're finishing up here pretty good here. So the difference between what we're going to get into here is original Medicare and Medicare Advantage. Original Medicare benefits are on the left side. Medicare Advantage plan benefits are on the right side. So You can use any doctor or hospital that takes Medicare anywhere in the United States. That's what we just discussed. That is your network. That is who you ask your provider, do you accept this in order to go? And this would be, again, if you're on the original Medicare as your health insurance and you have a prescription drug plan and possibly a Medicare supplement plan. So that option one back on the third screen. Medicare Advantage plans, in most cases, you can only use doctors and providers who are in the plan's network or service area for non-emergency care. Some plans offer non-emergency coverage outside of network, but typically at a higher cost. So a PPO, one of their designs is that there are two sets of networks. There is a contracted or in-network, and you might be able to find somebody outside of New Mexico who's in network. But if you went to another hospital that accepts Medicare Advantage plan, so they have to accept the Medicare Advantage plan, and but they are not contracted with the specific carrier you're with, then you would fall into having to pay the out-of-network benefits. In most cases, you don't need a referral to see a specialist, not from an insurance standpoint. But if you're going to see a specialist, they may want a referral from a primary care. You may need to get a referral from a specialist. Some of these plans, especially the HMOs, that's the old gatekeeper way of doing things where everything comes through the primary care. For Part B covered services, you pay 20% of the medical approved amount after you meet your deductible. This amount is called your co-insurance. This is what I talked about where I'll get to this later. Out-of-pocket costs vary on a Part C. Plans may have lower or higher out-of-pocket costs for certain service areas. For certain services. You pay a premium, a monthly payment for Part B. If you choose to join Medicare drug plan, you'll pay a separate premium for your Medicare drug coverage. You pay for a monthly under Medicare Advantage plan. You pay for a monthly Part B premium and may also have to pay for a plan's premium. Some plans may have a zero premium and may help pay all or part of your Part B premium. Most plans include Medicare drug coverage. This little piece right here said a lot. So one of the main reasons why people find Medicare Advantage plans suitable is because there is not a monthly premium for them. Yes, you still have to pay your Part B premium, but you don't have a monthly premium. And then that becomes the difference in how these are charged. So you don't pay a monthly premium, but if you use it, a Medicare Advantage plan, you have a copay for these services. So on these services, okay, I'm going to my primary care. It's not a preventive. Okay, it's $25. So it has the schedule of all of these pieces, and most of these most of these Medicare Advantage plans with prescription drug plans still have a zero premium. They might have another premium, a little bit of a premium, but they might have plans that don't have premiums. There is no yearly limit on what you pay out of pocket unless you have supplemental coverage. So here's the other kicker that ends up happening, why people add the fourth leg to that option one stool, is because we talked about up here in the first one, you pay for 20% after your deductible. So a Medicare supplement plan supplements it and helps pay for Part A and Part B services. Because if you don't have that, let's say somebody ends up having outpatient chemotherapy treatment and back up on number one, you're paying 20% of that. Okay, that's $10,000 and you haven't stopped the loss. So if you have labs after that, okay, you're going to have to pay for those. So that's where the Medicare supplement plan comes into place and why a lot of people go ahead and choose that with that option one design so that you can stop your exposure. On Medicare Advantage plans, though, they have a yearly limit, and that's what we're always concerned about is, okay, well, in a worst case scenario, how much would I be out of pocket? And that's going to be for Medicare Part A and B services. So why am I defining that? Because it's hospital and medical services. So people will say, does my prescription cost go towards my yearly limit? No, they don't. Only medical and hospital. Here we discussed about getting the Medigap plan, and you cannot get a Medigap plan with this. Where original Medicare covers most medically necessary services. We've kind of discussed this. In Medicare Advantage plans must cover all the medically necessary services that original Medicare covers. Plans may also offer some extra benefits that original Medicare doesn't cover, like vision. They're both covering the same thing, but they do it a little bit different. Over here on original Medicare, if you don't have a Medicare supplement plan, all right, if it's outpatient, then you're going to be paying 20% of it. If you have a Medicare supplement plan that has a premium, then it may pick up some of those charges. It may pay the 20%, but you're paying $150 or $200 for your monthly premium. But you get the same coverage over on the Medicare Advantage plans, meaning that we end up having that it will pay for medically necessary things, but it's usually done on a copay basis. You can join a separate Medicare drug plan. A lot of times with Medicare Advantage plans, it's included in this. And in most cases, you don't have to get a service or supply approved ahead of time by original Medicare to cover. That I would say is, do it because be sure about that one, because, if you get a coverage and it hasn't been approved, then you could then find out later. You'd have to be reactive instead of proactive about getting it covered. And in most cases, you have service or supplies approved ahead of time to cover it. Original Medicare doesn't cover things outside of the United States. Medicare Advantage plans don't generally cover things outside of the United States. But if you recall, we do have emergency room coverage service. So you would go ahead and look at paying for a service if you were visiting France, and then bringing that claim over to the stateside and filing it directly with the insurance company. So you can find out, I think this gets back to that original question, you can find and enroll in health drug plans through Medicare.gov. You do the plan compare. That's what I also assist with. Once you understand the plan's rules and costs, here are ways to join. You visit the plan's website, go online, fill out a paper enrollment plan if you want to. You can do it through Medicare.gov, or you can call Medicare, or I would put it in here, you can call me also. Now, the last piece here is the Medicare Advantage plans are graded, and it's on a 5-star basis. The 5 stars is considered excellent. There are very few 5-star plans in the United States, okay? 4 stars above average, 3 stars average, and 2 stars, and this could be 2.5 stars, is below average. If you get to 2 stars, the below average category, Medicare, Centers of Medicare and Medicaid give you 2 years to get that up, all right? Or else they say that then they want you to cancel the plan if you don't. We end up having 5 areas that that they base these 5 stars on: preventive care, chronic condition management, members experience, customer service, and member complaints. So you want to also know why you're getting all of these calls and asking you questions and do you want this service? Do you want this service here? It's because if they can raise up, if an insurance company can raise their star up even by a half of a star, we are talking about them getting millions of more dollars here. How is the rating determined? Annual review. We've already gone over the multiple categories, and the Medicare Advantage plans are based on how well they're performing in all five of these categories. So some of the people, some agents back in the day are rating in preventive services. Well, that's not a all-inclusive kind of thing. Well, what's their overall star rating? And why are star ratings important? So the annual review, let me hop back, take a step back. The annual review is that they review it and then they apply the star. So what we're going to be looking at for stars for 2026 Medicare Advantage plans are how they performed in 2024. Okay, because that's their full year. They've compiled all of their surveys and boom. So it does matter if you do those surveys, okay? But they can be inundated. Why star ratings are important? It's a good way to go ahead and see what the quality of this is. Bonus payments, again, with 4 and 5 stars can receive financial bonuses from the government. So that's important. If they're at a 3-star, they want to get to be a 4-star because it's a lot more money. Plan performance. The ratings are a yearly measure of plan performance and can change from year to year. So this is why they want everybody to have the star ratings. So that is it. And I know that was a lot.
So, Brad, I have a question. When you go to Medicare.gov, do you see both the original Medicare options and Medicare Advantage?
They have an option. Well, they have information on Part A and Part B benefits. Okay, but there's not necessarily okay, I'd like to see what all my benefits are. You kind of go into the search bar and say, okay, what does Part A cover? What does Part B cover, kind of thing. And but if you go into that plan search, that's when you can go ahead and look at a comparison of what's available for Medicare Advantage plans.
So you can see so you can see both the supplement, let's say, and so Medicare A and B, that's over here. But the choice then is, do you stay with original Medicare or Medicare Advantage? And the question would be, would you see like carrier A that has both all the supplement programs and the Medicare Advantage? Do you see those with the different benefits and premiums?
Well, okay, so when you get a Medicare supplement plan to supplement your health insurance, original Medicare, which is you don't, even though it's offered by an insurance company, you don't go ahead and have to work within the insurance company's network. These are their only requirement on Medicare supplement plans is if Part A and Part B approve the charge. So if they do, then the Medicare supplement plan will pay their portion. So there is a table of what the different Medicare supplement plans are, and that ends up telling you then what would be paid for. So if you have a plan G and you are going in for your initial service is going to be an emergency room visit, you're going to have to pay for your the first $257 or $615 in $288 in 2026. that's the deductible, but then the 20% is covered at 100% from the Medicare supplement. So they don't really say here's a comparison of ABC Medicare supplement plan G and DEF Medicare supplement plan G, because they're standardized. So we're more concerned about is it covered by Medicare and do you accept Medicare? Because we need them to approve these coverages for then it to go ahead and initiate the Medicare supplement plan to cover it.
Yeah. I guess my question is like, it really is when you're on Medicare.gov, or do you need to go to the carrier site to find out what their advantage programs, what level of advantage programs they have?
Okay, so we're changing gears here. On the Medicare Advantage plans, you can see all of these. And what they'll do is when you're doing this review, you go in for this plan comparison. It'll ask you your zip code. It'll ask you what you're looking for. Is it a Medicare Advantage plan? Is it a standalone? And you can put your prescriptions in, and you can put pharmacies in. And then when you hit submit, it gives you a report that prioritizes all of the plans in your service area from the least expensive to the most expensive. And typically that comes down to jugs.
And that's on Medicare.gov?
Medicare.gov, exactly.
Okay, that's great. That was really the question, is where can I look and compare Medicare Advantage programs without having to go to all these different carriers that have Medicare Advantage programs?
Medicare.gov. But if you're trying to compare what original Medicare with a Medicare supplement plan has with a Medicare Advantage plan, you're not going to find a place that puts a side by side on that. It's going to end up being, okay, find out how original Medicare is going to do it, how your Medicare supplement plan is going to cover it, and then over here you can find out how a Medicare Advantage plan is going to pay for it.
Right. And then so somebody was asking, they said, should we go to Medicare.gov and compare before I meet with a Medicare plan specialist? I think you should, because the more knowledge you have, the more it's going to make sense. I mean, when you start into this, it's kind of like, wow, and you start narrowing it down. And then once you've looked at compare, you say, well, the out-of-pocket money is more important to me than going to a specialist in Arizona, then you can talk to an individual like Brad and say, this is my priority, so let's find the best program for me locally, or I want to go everywhere, so let's find the best program for me nationally. And the thing is, the national programs, like Brad said, are very specific. They have alphabetical designations, and they have to be exactly the same, but their premiums can be different. So that's the only
Exactly. So they're the same, but they're different. That's my conclusion. Okay, they're the same. You're doing the exact same thing. You're trying to accomplish. You're administering Medicare, but they do it a little bit different, and not one way is better than the other. It's what's going to be suitable. If you don't want to be bogged down with having to look at networks, okay, then the original Medicare with a Medicare supplement plan is probably your priority. If you don't want to spend a lot of money, even if you don't use it, then the Medicare Advantage plan is typically a better way of going about it. But we do back our way in on a Medicare Advantage plan. It's like, okay, I find that this is more suitable for me. Okay, now we need to find out, okay, who's your doctors? Who's your specialist? If we might have to find out who your dentist is. Where do you go for your vision? And because everything is network based with the Medicare Advantage plans. But everybody who remembers insurance prior to getting on Medicare, you had to do the exact same thing. So it's not, I'm just hammering it because I want you to know the difference. So there you go. That's it. not in a nutshell, but that's it.
Well, thank you everybody for coming. I know it's a bit overwhelming. To me, again, it goes back to knowledge is power, and controlling your own medical care is absolutely critical because you're the only one who has the vested interest in it. And having somebody that you can call, like Brad, as your agent to be able to say, hey, let me have peace of mind. What is it going to cost me? What's going to be my out of a pocket so that he can say, well, this may happen, but let me tell you, it shouldn't. Don't worry about it. Or yeah, you're going to have this deductible coming through. And so that to me gives me a really good peace of mind. And thank you all so much for coming.
I had a
And
question. I had a
yes,
couple of
Lynn.
questions, the chat that weren't answered. It says on the web that you have to give them your current insurance, the start date and the ending date. If you have current insurance, how would you put an ending date?
Are you talking about, are you enrolling or are you comparing?
Enrolling.
Right. So typically what all plans are now, especially unless you're with an employer group, that all plans.
I'm with an employer group.
Okay. So when was your last renewal on your
Um,
employer?
I pay quarterly. So I'm now
Okay,
in the last
that's not
quarter
my.
and I've paid for it.
Okay, so my question is when do they give you paperwork that says, okay, you have to choose what you want to do, that this is our open enrollment? Is it for a January 1st effective date, or is it sometime before that?
No, it would be in sometime in November and it would start next January.
Okay, so January is your effective date. So your plan every year starts January 1st. So when you're enrolling in your thing in your plan, then you put that your plan started January 1st of 2025, and let's say you're going into Medicare, you want this to start November. Well, then your plan is going to be terminated on November 1st, or you can put in October 31st if you want.
Well, the administrator said she would keep me on the plan until I could sign up for Medicare.
Okay. All right. So there you go. So that last piece. So it's easy to answer the first question as when did my plan start? It's that second question that we don't really know the answer to, but you can do this all pretty quickly. If you've got Part A and Part B, well, then getting into a Medicare Advantage or a Medicare Supplement plan is very easy and can be done pretty much within a few days. And when I say a few days, if you're enrolled within a few minutes, but then you even get your paperwork and cards and stuff within a few days.
Okay, well, I'm going on the phone, so I don't have problems like this. But so they'll have to figure out, and when the plan started, like in say 2015, wouldn't that be like the state start date?
No, because your plan starts every year. Every time you have
Okay,
a renewal, your plan starts. So January 1st will work of
okay,
2025.
okay. And so okay, so really the ending date would depend on what they're telling me when they would put me on Medicare.
Sure. Yes. Now, have you already enrolled in Original Medicare? Do you have
No,
your
I
red,
haven't.
white, and blue?
No, I haven't done any of that. I tried to get an appointment a long time ago, and they're giving me in about 2 weeks from now, and they said they backdate me calling them. So it's a little bit more confusing.
Well, and again, it's not a real area. We went over this a little bit when the last week's seminar of how to enroll in Original Medicare via the Social Security Administration website, because Social Security is the one that handles that. So you can initiate that yourself and get it accomplished without having to worry about an appointment for that. But again, yeah, now you got to enroll in it, find out when they're going to make your A and B effective, and then you can go ahead and bring that to your employer and say, yeah, at the end of this month, I'm on Medicare.
Okay. Okay. And so
And
if you
do
do
we?
it online, if they ask you to do Part B, it says that you have to give your existing Medicare. So will they give you right away if you signed up for Part A? So then they give you the number. So when you're doing Part B, you have the number.
Yeah, that's one scenario. I mean, if you want to sign up for A, but most people sign up for both A and B when they're
So that
enrolling.
okay, so that's so then it's at the same time. Okay.
Yes,
Okay.
it can be separate. You know, again, in a scenario where you're working and you want to continue to work and the employer has no problem you staying on the plan. All right. Well, a lot of people get Part A because they're entitled, and so they have the double coverage. But most people, we want everything to start on the same day so that we can have everything kind of coincide.
Okay. Okay. All right. So what if they backdate me calling them?
Well, then you're kind of your employer is kind of on the hook for still paying until your end of the month kind of thing. So I mean, if you are going for, let's say, a November 1st effective date, let's say that
Right,
so
right.
that your Medicare Advantage, I mean your Medicare original Medicare enrollment is November 1st, and they say that they're giving you Part A and Part B as of October 1st. Well, unfortunately, we kind of found out about that after, and maybe your group can call to get a refund of your portion because you have other coverage, but it's sometimes they say yes, sometimes they say no, and the employer's out for that. So, but you can't get A and B. I mean, you can't get a Medicare Advantage plan or a Medicare supplement plan until we know what A and B is. So if you found out today that your A and B is effective for October 1st, the the soonest I could get you a Medicare Advantage plan or supplement plan would be November 1st. So it would be the first of the following month. So it's not a bad thing if you're covered by original Medicare and by the group plan. The reason why some people don't like that is because they usually have a cost sharing with their group plan, and they end up starting to get their premium for their Part B. So yeah, they're double coverage, but you're paying two premiums also.
So my appointment is on October 27th. May that be too late to sign up for Medicare and get going? Maybe I should try doing online so that there'd be more time to get it to work starting on November 1st.
Well, yeah, if that's what your intent is that you want to get enrolled as fast as possible, I highly recommend you try to get onto the Social Security website, um, and enroll in there. When you get on there, you're going to have to register, and then on the
Mhm.
home page they'll probably have you now register under ID.me. So they're trying to get like this all inclusive that you can sign into the IRS and Social Security with one ID. And then when you get on your Social Security page, then there will be a window there that says enroll in Medicare, and you click on that, and then you go through the enrollment, and it'll ask you, do you want to enroll in Part B? And you say yes, and then you submit.
I think in this day and age with our situation with all the layoffs and furloughs, you do have an appointment, but that doesn't mean you're actually is that going to ensure you actually can get anything done at that moment? I think the most efficient way is to go online and go ahead and get your Medicare at Part A and B, and that way, as long as you can then you can make your decision about your supplement or your advantage plan.
I agree.
Okay. All right.
Eh,
So that's not a problem if you're already on other insurance. If you suddenly go on Medicare, but there's a gap between going on Medicare to getting the added advantage. Or you're saying just be a few days when I tell the immunity, but she was started November 1st, or she'd started for October 1st. You can't backdate that.
Yeah, Lynn, I don't think we can go too much further into the
Okay.
personal.
All right. No, that's fine. I appreciate it.
Yeah,
Okay.
but I
Thank
think
you.
the point is here is to make sure that you go ahead and get signed up. It sounds like your administrator is very open to what you do, so you're not in a conflict with them. So they're not trying to shove you out. So just go ahead
Right,
and
right.
get your A and B, and maybe there's going to be a November where you have both coverages. So
Okay.
what?
Thank you.
Yeah, no big deal. But you want to have at least the coverage. That's the main thing. You don't want to lose your coverage.
Thank you very much. I really appreciate it.
Yeah, sure.
And anything else in there, or
And we just had some personal things I don't think we can, for example, somebody wanted to know if about, if something was a doctor was covered in the hospital. That is again, it's going to be a one-off situation. You're going to have to find out which plan you're on, what plan you're on, Advantage or Medicare or whatever it is. And I think that's the situation where some people have gotten into out of hospital billing. But I think that that's a situation, if you have an agent, you can call and say, do we run into that problem here? Because that surprise billing, supposedly they've closed that gap, but that's not necessarily always true.
and always with the Medicare Advantage plans, if you go to their website, on their very first site, you don't even have to register or anything like that. They have find providers. And you can go in there and find out if a hospital or a specific doctor is included in there. If you're on original Medicare, all right, you just want to know, you can call your provider up and say, hey, do you take original Medicare? And if they say yes, then they're going to go ahead and take the supplement. You don't have to ask them, okay, I have a supplement from ABC Insurance Company. Do you take them also? That isn't how it works. It works in tandem with original Medicare. Well, thank you very much, everyone. I really do, again, appreciate this and this opportunity. And if anybody needs any assistance, you know how to get in touch with me. But I hope that this was informative. And I certainly do enjoy these an awful lot, even though there are certainly a whole lot better conversations or topics than Medicare. But it's so important now, and it is getting more and more particular. So thank you, Villages of the Santa Fe. Thank you, Ann.
Thank you. And again, we'll have the recording up, and I'll have contact information in our blogs at www.villages. Let's see if I can't spell it. villagesofsantafe.org. I'll have that up by Thursday. Thank you, everybody. Good to see you.